Greetings, everyone. This is Dr. Krishna Priya, Orthodontist and Aligner Specialist. The topic we are going to discuss today is biomechanics of tooth movement. It is a very important technical oriented concept which you need to understand before understanding what orthodontics is actually about. Please pay attention, and I really hope you take some key points from this lecture. Going into the topic. Today we will be covering mechanical concepts in orthodontics, moment of force, moment of couple, what are the different types of tooth movement, anchorage, types of anchorage, application, and conclusion. So, introduction is very important whenever you start writing in any paper. So, be very concise. Here, in biomechanical aspects of orthodontic tooth movement, it is a biological cascade of events which results in bone remodeling. And orthodontic tooth movement begins by the activation of forces across the PDL and also the bone along with the tooth. It is both predictable and controllable. By varying the ratio of moment to force applied onto the teeth, we can predict the tooth movement, which is actually happening here. So they obey the law of physics and can be activated to generate the desired forces in order to achieve predetermined treatment goals. Why I am mentioning these points is that please make a note of it and use it in your exam notes. You should use all these keywords so that it will help you fetch more marks. So here we now understand it is a biological cascade of movements to achieve a predetermined desirable tooth position which occurs by bone remodeling and application of moment to force onto the tooth. What is mechanics? It is just a discipline that has the effects of forces on the body, which is desired. What is biomechanics? It is a biological involvement in this mechanical system. So, here in the mechanical concepts of orthodontics, what we now understand some very basic terminologies which will help us understand the concept of tooth movement. First, we'll start with force. Okay. Force is not something that we give on to an object. Force can be scalar and also vector. So, what is force? It is a physical property which has only magnitude. If a force has magnitude, we call it a scalar. And if it has a direction, that is, when you push an object from here to here, it has a direction in which it moves. So, that is called vector. So, scalar is a quantity and vector is the direction. When a physical object has both scalar and vector, then we have that force character, which also constitute of magnitude. In this image, you can see there is a tooth here, right? A force is given here, which this is the point of application. It has a direction, which means force is vector. This is the line of action the movement occurs because it holds a value of how much grams of force we are giving on to the tooth, 40 grams, 50 grams of force. So force here is actually a vector quantity and also it has some magnitude. So you have to understand this. Point of force application, sense of direction, line of direction, and a magnitude. So a force, right? Now we've described it. When it is divided into two components, basically here, when you apply a force onto the teeth, it is divided into a vertical part and also a horizontal part, as you can see here. So this force is basically a resultant of a vertical and a horizontal component. So here we have the terminology for it, which is called a parallelogram method. It is very simple. You have a force here, right? So it is divided into a vertical and a horizontal component. Thereby, when you complete the vertical and horizontal, it forms a parallelogram. So the remaining will be the diagonal, which is the resultant of the forces. So what is the resultant and the component of orthodontic force system? So pay keen attention to this point as well. The movement of teeth is actually by the knit effect onto the tooth. For example, I am holding a phone in hand, right? When I'm putting my force onto that phone, it will move in this direction. But what if I'm giving a force here, I'm giving a force here, here? It will only move in the net concentration of force which is applied on it, meaning it will absorb all the forces and move finally in a resultant direction. That is, whichever direction the force was very large, it will move in that direction, obviously. So, the resultant and component of orthodontic force system also works as that. It will take by the net effect of forces acting on it. So the combined applied forces may be a force on the tooth, which will break into different components, like we decided, a vertical component and a horizontal component, based on which the resultant force is actually acquired. It may be useful to resolve it in this way. Where it will be useful in orthodontics, basically, you would have seen in face mask or headgear. Sometimes we take anchorage from your neck, okay, just a cervical one, and sometimes we take advantage of the head, which is a high pull headgear, and sometimes the combination. Where would we get this idea? Can you see here? Based on this point, okay, this point of application, and based on the distance between here and then here, we determine how long and what is the magnitude of the force to be given. So here, as you can see, it is divided into a vertical component and a horizontal component, and the resultant force will act in a parallelogram method in this direction. The resultant of two forces with different point of application can be determined by extending the line of action to construct a common point of application. I think now you understood what is force, scalar and vector unit, parallelogram method, and how the resultant of force is calculated, right? Now we move on to the second one. What is the center of mass? So here you see a pencil, right? So the pencil is there and there is something marked in the center. That means each body has its mass concentrated at one point of time, which is actually its center. It may not be the center of an object entirely because not all objects are symmetrical, but a center of mass is a point which would be balanced, right? What is the center of gravity? So the same is called the center of gravity in an environment wherein the gravity is present, like on Earth. Okay. Here, I think you can see the pencil example, which is very, very simple. What is center of resistance? So the center of mass of a free body is the point through which an applied force must actually pass to move it linearly without any rotation. Basically, you see, if you have a tooth here and I put a force here, right? The tooth should move like this. Basically, the tooth should move in a straight manner without going down or going up, going tipping this way, rotating this way, nothing like that. When I'm giving a force here, it should move like this. So the point where the tooth actually moves straight is called center of resistance. And it depends on a lot of things, like what is the size of the tooth and how it is actually made of, what are the number of roots in it, and what is the bone support of the tooth. So a lot of things is dependent on finding out the center of resistance for any given tooth. Let us take this example. So for this particular tooth, the center of resistance may be somewhere here, correct? It is the center point. And you can't take it here because this is the root and this is the crown. The root is actually covered by bone. So this is more dense, and therefore the center of resistance always resides in somewhat here, in the middle to the apical third of the root. But when you take two teeth combined, it is going to shift here because this tooth is comparatively large when compared to here. So we have to take all things into consideration. Now coming here, center of resistance is maxilla. So the maxilla as a whole unit has a center of resistance located very close to the pterygoid fissure. Coming to a single tooth, see, when you take a molar, since it has three roots, the center of resistance is actually located near the fulcrum. So now you understand the concept of it. And also, it depends on the bone covering it. Since the bone covering the root acts as a very strong unit, the center of resistance is more towards it. But when the root coverage is also less, it goes towards the tip of the root. So basically, the center of resistance of 6 anterior teeth is nothing but 7 mm apical to the interproximal bone. Basically, the point where the root starts coming, and therefore it is mostly between the apical and middle third of the root. So for example, here resistance of 4 anterior teeth, when it comes to 4, it becomes plus 5. When it comes to 2 anterior teeth, it becomes plus 3.5 apical to the interproximal bone. So the little difference in the moment to force ratio is required to translate. Basically, center of resistance is a point through which when a force is applied, a tooth is going to move bodily. There is going to be a translation. That is a very, very pure line of motion without any deviation. So it may change based on the number of teeth we take into consideration. So this also happens not only in this direction, but also in this direction, which is called an intrusion. So when the anterior segment has only 2 central incisors and we are trying to intrude it, we have to pass the center of resistance, the force, based on a projected line, which is parallel to the mid-sagittal plane. Okay. So that point is actually the distal half of the canines, because we are now talking in this direction, whereas we have to move the tooth in an upward direction, right? So the anterior segment, when it includes 2 plus 2, 4 incisors, the center of resistance is actually perpendicular to the occlusal plane between the canine and premolars. Now, as you can see, when we go for intrusion, the center of resistance keeps skipping behind as we increase the number of teeth. So, was found in different occluso-apical position depending on the direction of force. Thus, the location of center of resistance cannot be considered a constant independent of the direction of loading for the tooth with a given support. It always is dependent on a lot of factors to arrive at a CR. Now we understood center of resistance, right? Now we are going to talk about center of rotation. Basically, see, if I'm taking a pen here, right? So when I'm holding the pen like this, I'm holding it by center of mass. At this point of time, under gravity, I can actually balance the pen easily. So when I'm putting a force through the center of resistance of any particular tooth, it is going to move like this. Now, what is center of rotation? It is the tip of the root or the tip. So when I'm going to give the force in a very, very opposite direction of the point of application, I'm going to rotate. It's not going to move straight. Instead, it is going to rotate. So this is called the center of rotation, a point which a body appears to have rotated as determined from its initial and final position. So this is center of rotation. Either the point can be here, wherein I push the force here and it moves, or the point may be here and I'm giving a force and it moves. Correct? So the more nearly translational the movement, the farther apically the center of rotation. The extreme case, with a perfect translation, what happens? There is no rotation, right? So the point of center of rotation is going to be at infinity. Now, see, when the tooth is moving like a translation, the center of rotation point is at infinity. But when there is a center of rotation point here, then the tooth is going to rotate. Okay? Understand that? Okay. So here in this tooth, you can actually see when you take only a single tooth as an example, this is the center of resistance of a maxillary central or maxillary canine. So from here to this point, this is the point where we stick the bracket onto the teeth. So we mark it as A, distance, because this is where we want the bracket onto the tooth and this is where the force is also given, right? So this becomes the point of force application. So the point of force application to the center of resistance is A. B will be from the center of resistance to the center of rotation as we have just understood. Okay. And what is C? See, from here only the bone support also starts for it. So the alveolar crest to the point of force application will be C. And what is L? L is the root length. So CR is the center of resistance. So this is going to be the formula in order to identify how much is the body's resistance to the translation or to the tipping or rotation. So you should understand these values, and this diagram is very important in understanding the biomechanical concepts of orthodontic tooth movement. Now coming to sign conventions. Basically, we say intrusion, we say extrusion, translation, and such things, right? But whenever a force is acting in a particular direction, we give it positive value. Whenever it acts in a negative direction or opposite direction, we give it a negative value. Let us understand which is positive and which is negative. There is a universal sign convention, okay? So movements are positive when the crown is mesial, buccal, and labial. Basically, when the movement is buccal, that is outside, labial, okay, or mesial, that is moving towards the central line, the universal sign convention is positive. Don't try to remember negative also, because the opposite of positive is negative. Only remember one thing. When the tooth movement is in buccal direction, buccal or labial or mesial, it is going to be positive. Now coming to the important part, moment of force. So we've talked about force, we talked about CR, center of rotation, and how to formulate the resultant of the force. But now we are going to talk about the moment. What is a moment? When the force is not passing through center of resistance, because it is difficult, right? We cannot go and bond a bracket onto the tooth, whereas the center of resistance is in the root, as we have seen in the previous picture. So since we can't bond the bracket onto the center of resistance to get a nice translation, we are going to bond it somewhere on the crown. So it is obviously always at a distance from center of rotation, center of resistance. So when we give a force at a distance from CR, what is going to happen? So this is the CR, but my bracket is here. And this is the distance between the CR and the bracket. So when I'm giving a force here, it is going to tip. My tooth is going to move like this. So this is called a moment. How do we calculate it? What is the magnitude of it? So already we know this is the bracket and this is the distance between the bracket, that is the point of force application, and the center of resistance, right? So now we know the distance of it, and now we know what is the force we are applying on it, and thereby the multiplication gives us the moment of force. Basically, Newton is the force value and mm is the distance. So the direction of the moment of force can be determined by continuing the line of action around the center of resistance. Basically, if you give a line of direction in this manner, when you continue the line of action, it is going to give you from where the tooth is going to tip into, the direction of it. If you're going to give it from inside, it is going to go in this direction, right? So this is how we decide how the tooth is going to move when a force is given to it. Now we understood moment also. Moment is nothing but we are applying a force at a distance from the center of resistance. So our direction is going to determine how the tooth is going to tip. So if it is going to tip in this direction or this direction. So this direction has a value. And also we are applying a force, and thereby we get a value which is called moment of force, MF, right? Now coming to couple. What is a couple? Couple consists of two forces which is of equal magnitude with parallel but non-collinear line of action and opposite axes. Basically, you all remember seesaw, right? Seesaw is actually a perfect couple. When one goes up, the other is down, and it is also the opposite of it. Couple is also like a merry-go-round. So when one person goes in this direction, the other person comes in this direction. Like it's like a merry-go-round. So imagine these two scenarios, and then you'll arrive at a very, very clear point. See, when you take a tooth, basically it is rotated, and how to correct it? You give a button here and here. You give this button and put a force onto it in this direction. Same in the opposite direction. What happens? Both these forces will make sure it moves in the same direction and thereby correcting the rotation of the tooth. So this is how a couple works. And now we come to the moment of couple. So couple is nothing but it's a phenomenon of when we give a force in the direction, it is going to move. And when the same magnitude is given in the opposite direction, it is going to rotate. It is going to go around like a merry-go-round, right? So what is the moment of the couple? Here also we are going to calculate the distance from the center of resistance, and then we are going to calculate how much it is going to move. It is of the same formula. So the moment of force is always relative to the point of reference. So a couple is no more than a particular configuration of forces which have an inherent moment. The moment of couple is not relative to any point. So now we understood moment of force and moment of couple. So in orthodontics, depending on the plane in which the couple is acting, they are actually called as three orders. Okay. First is rotation. As now we saw, when couple is two forces of equal magnitude acting parallel to each other in non-collinear manner. So if it is rotation, it is first order. If it is tipping, rotation meaning it is connected to the adjacent tooth of the same arch or something. Tipping meaning it is concerned onto the same tooth. It is happening between the wing of the brackets. And torque meaning it is happening between the wire and the bracket of a given tooth. So it may be different areas, but the moment of couple is the same concept. So now we're going to understand moment of force ratio and type of tooth movement. Okay. So this is also very, very important. You'll get a lot of questions on this. The ratio of two has units of millimeters, which is represented by the distance away from the bracket from a single force which will produce the same effect. We are giving a force here, correct? Point of force application. So this is the distance, which is 10 mm, and 100 grams of force is being given. So this is 10 mm, 10 grams, 100 grams of force is given. So 100 into 10, nothing but 1000 gram mm is the moment of force. So what is tipping? Just now I showed you, right? The center of resistance is here, but the point of force application is here. And when the point of force application is here and we are giving a force, it is going to move. So this moment is called tipping. So there are two kinds of tipping. One is controllable and uncontrolled tipping. Controlled tipping is that the movement is happening only in the crown part at the root apex. Basically, how we decide is that when the moment to force ratio is 7:1, when the distance of the center of resistance to the point of force application is 7 mm, and you give a point of force application, the force, the tooth is moving. Only the crown part is actually moving, right? That is called control tipping. So in this point, the center of rotation usually will be in the apex of the tooth. Okay. Now, what is uncontrolled tipping? Uncontrolled tipping meaning the between the center of resistance and apex, the center of rotation is going to be somewhere here. And the moment of force ratio will be 5:1. So here what happens? The tipping happens, the crown moves, and as well as the root is going to move in the opposite direction. We do not want that. So that is called uncontrolled tipping. So here it's a very easy example. 4 things are given here. So this A is called uncontrolled tipping. This is the bracket which is same in all the given areas. So here the point of force application is here. So the center of rotation is at this point. So whenever we apply a force, only the crown should move. But in uncontrolled tipping, the crown is moved this side, the root is moved in the opposite direction. So this is a perfect example of uncontrollable tipping. So what is B? What is happening here? The force is actually applied here, but only the crown is moving. The root is remaining constant here. Some moment to couple and moment to force is happening, and the counter moment is given to prevent the root movement at all. So this is called controlled tipping. Coming to C. C is the most ideal thing. Basically, what is happening here? The crown and the root is moving in a synchronized manner. Even though the force is not passed through the center of resistance, it is passed through this point of application, but some counter moments and counter couple later, the tooth is actually moving in the straight line. So this is called translation. So this happens when the moment to force ratio is 10:1. Here in the last picture, you can see that the root is moving and the crown is actually staying constant, right? So this is the root movement. Everything has a particular ratio. So when it is 14:1, it is root movement. It is all dependent on the moment of force ratio value. So here you can see this is the CR and the point of force application is here. when the point of force application goes very, very high, the force is very high, or the point itself is very low to the incisal tip or to the gums, then it is going to increase the tendency of rotation, just like this. When it is close to the center of mass, it is going to move in a straight manner. But it is above or below, the center of rotation is going to happen. So translation is something which happens at the moment to ratio 10:1. And root movement happens when it is 12:1. Pure rotational movement happens when it is 20:1. That is, the root and crown move equally in an opposite direction. That is called pure rotational movement, as you can see in this point. So here translation happens. Here the root movement happens. Here the root position is actually constant. So control tipping happens here, uncontrolled tipping. So we now come to the end of biomechanical concepts, and you should always remember Newton's laws. The first law is law of inertia. The second is law of acceleration. And the very important is the third law, which is the law of action and reaction. The every action, there is an equal and opposite reaction. So this is what governs the moment everywhere. So we now come to the end of biomechanical concepts and now go into anchorage. So anchorage is nothing but the nature and degree of resistance to displacement offered by an anatomic unit when used for the purpose of the effective tooth movement, Weber. So these definitions are really important. So basically, what are all these anatomic units which is used for anchorage? Mostly teeth, sometimes palate, lingual alveolar supporting bone and mandible, cortical bone, muscular anchorage, occiput, and the back of the neck, and some orthopedic appliances. There are different types of anchorage: simple, stationary, reciprocal, intraoral and extraoral, intramaxillary meaning between the tooth in the upper jaw or the lower jaw, intermaxillary meaning elastics between upper and lower jaw, multiple anchorage, and cortical anchorage. So simple anchorage is nothing but a manner and application of force which tends to displace or change the axial inclination of the tooth or the teeth that forms the anchorage unit in the plane of space in which the force is being applied. So the key word being axial inclination of the tooth is actually changed, right? So that is called a simple anchorage. What is a stationary one? Displace the anchorage unit bodily. That is, it is going to push the teeth in a bodily manner. So when it only changes the axial inclination, it is going to be simple. If it is going to push it, translate it, it's going to be stationary. Reciprocal meaning there are two things which is going to happen in equal and opposite manner in opposing dental units. Anchorage in which the resistance of one or more dental unit is utilized to move one or more opposing units. So this is reciprocal anchorage. Extraoral, we have something which is outside the oral cavity like cervical, occipital, and cranial. Headgear is a very good example. So the first one is a combination headgear. This is a combination headgear, and this is cervical, and this is occipital, right? And there are different components. There are a head strap in it, which is named according to where it is used. There is a face bar, which is an inner one and an outer one. This is the inner bar, which is actually inserted into our upper jaw where the hyrax is actually located. The outer bar will decide the direction of the force. Coming to the force system, based on the orientation of the jaw, the length of the outer bar, and the point of attachment, we can actually find out how much force to be given. And this direction of the force and the moment can be calculated by the application of force more close to the center of resistance. So in occipital pull headgear, it is going to be something like this, because this is the molar and we are utilizing an extraoral anchorage here, and we are also using an elastics to make the tooth come forward and upward or inward, right? So based on the amount of force, we are actually making it possible. So in cervical pull headgear, the same thing, the direction is going to be down. So the molars are extruded and also kind of distalized. So this you would make sure you learn more about it in orthopedic appliances. So this is just like anchorage. I have to explain how it is taken. So these are some examples of extraoral anchorage. You can mention cervical pull, occipital headgears and combination headgears. What about the directions and how it is actually used? Coming to intramaxillary anchorages, it is the resistant unit situated within the same jaw. Inter is nothing but elastics. It's also called as Baker's anchorage. You may get a 5 mark in that. So coming to transpalatal arch, now we are going to discuss about intramaxillary anchorages. Extends from one maxillary first molar along the contour of the plate palate to the molar on the opposite side, TPA. So what are its function? It prevents the mesial migration of the upper first molar during the transition between deciduous molars to permanent second premolars. It can produce molar rotations and also change in root torque. It offers more stabilization and anchorage. Coming to lower lingual arches, it also has some similar functions like TPA, class 1 crowding and class 3 patients. It is actually indicated. Nance palatal button indications is in class 1 and crowding correction to hold the maxillary expansion achieved by the expansion appliances. It is not indicated in maxillary protrusion cases, especially in class 2, because the overjet cannot be corrected when that is present. So reinforced anchorage, what does that do? It is adding additional teeth to the anchorage so that the anchorage is really strong. That is usage of the palate and the guide plane anchorage from extraoral sources. So now finally coming to cortical anchorage, the different response of cortical compared to the medullary bone can be utilized for actually anchorage. And it is more resistant to resorption into movement, is slowed when a root contacts the cortical. So now coming to anchorage, basically it is tooth anchorage or some other thing called anchorage savers, which reduce the amount of teeth anchorage necessary to correct the malocclusion, like an extraoral part, which is called headgear, palatal bar, or lip bumper. So these are called anchorage savers, wherein we use something which is actually not tooth, but also help in anchorage. So basically in anchorage, it is also divided into 3 parts, which is group A, B, and C. Group A meaning when we remove the first premolars, every percent of the tooth, like, okay, you can see this image, right? So this is the before one, this tooth is removed. So maximum space closure occurs when the front teeth is actually going back, wherein the back teeth stays there. The posterior is actually there. 90% of the space closure happens by anterior retraction. In group B, 50% posterior protraction, 50% anterior retraction. In group C, 90% posterior protraction and very minimal anterior retraction. Okay. So, yeah. So we also discussed about the moment to force ratio, right? So in group B, it's going to be translation of anterior and posterior. So the moment to force ratio is 10:1. Here it is going to be 12:1 or more in the posterior because only the anterior is going to move very well. Factors which is affecting the anchorage will be root area of the anchor teeth, the force which we actually use to move the teeth, and also the mesial drift. And when you see about the root area of the anchor teeth, you will have to write in detail about larger surface area, which is small surface area, multi-rooted teeth, which is single-rooted teeth, which will provide more anchor, longer rooted teeth, which is shorter rooted teeth, and triangular rooted, which is conical root. So if you include a particular section on the root area of the anchor teeth, you would fetch more marks. And also concentrate on the forces used. The concentration need to produce tooth movement, where it is desired and how it will be dissipated and how many teeth it should be distributed upon. And what is the light force and what is the threshold value for it and what is the heavy force for your anchor teeth should be mentioned. So what is a mesial drift? What happens when there is an anchor loss? Because the resistance value is least in downward and forward direction should also be mentioned. And what would be the strategy behind the controlling of the anchorage to concentrate the force needed to produce the tooth movement where it is desired and to dissipate the reaction force over as many other teeth as possible, keeping the pressure in the pedial of anchor teeth as low as possible. So coming to differential anchor systems, you have some removable appliances like clasp, base plates, extraoral anchorage also can be removable. So these also you can mention. What about a clinical control of anchorage? So only few teeth are moved at a time or as many teeth are included in the anchorage unit and the appliance produces light forces. So these are some of the clinical control of the anchorage unit. So you can mention some of the appliances which we do clinically like sweat bite plane, anterior inclined bite plane. Coming to skeletal anchorage, the conventional method of reinforcing anchorage are less than ideal because they either rely on structures or they themselves potentially mobile. So skeletal anchorage has overcome so many shortcomings. So there are two types, direct and indirect, right? So direct, it actually uses force from an actual implant that takes the place of a missing tooth or eventually supports dental restoration. Indirect meaning it is only placed for the orthodontic purpose and it is generally removed once it is done. So generally we use the indirect ones, and we have three different designs, L, Y, and T, which is also important. So Umamari and Sugawara in AGO 1999. So please make sure you use these names. Titanium mini plates stabilized with screws. So where it is used, these anatomical sites: alveolar bone in extraction site, palate in the median and paramedian area, retroincisive, retromolar, anterior nasal spine, and shin symphysis. So now we've actually finished with the biomechanical concept and also Anchorage. So various mechanics can be used to achieve the tooth movement desired for the orthodontic treatment. But ultimately, clinically, it should be relevant and it should actually help the patient to achieve a better result. Hope you had all these things in mind, and please prepare your exams accordingly. Thank you. All the best for your exams.